Hello and welcome to today's daily briefing on KLAM and KCDV. I'm J.R. Lewis. It's Wednesday, May 6th, 2020. This program is brought to you to keep you up to speed on Cordova's coronavirus response efforts. 1 p.m., 5 p.m., and 8 p.m. hours each weekday, and also archived on our YouTube channel, which is youtube.com/Cordova TV. Mayor Koplin, it's not just you and I today. We actually have quite a group to make a pretty significant announcement, so let's dispense with pretense and get right into it. What do you want folks to know?
Well, we'd like to share what a lot have probably already seen flying around social media. We've been undergoing a lot of preparations as an incident management team to prepare for the if and when of a positive test case in Cordova for COVID-19. And we did have a positive test surface last night. And so this press briefing is to update the community and give you a little background and let you know what position we're in and what our response is.
All right. So could you introduce the members of the panel that you brought together for this?
Sure. And I think that this group and having us on here together is just a reflection of how we as a city and state and our business partners have been working together to plan and prepare for an incident like this. And so joining us today, we have Dr. Hannah Saunders, who is our director of the Cordova Community Medical Center and the lead our medical lead for the COVID. And then we have Mr. Mark Petrie, who is the CEO of Ocean Beauty Seafoods, who is a strong business partner with the city of Cordova. We have Louisa Castro Dale. She's with the state of Alaska's epidemiology department. And then we have Dr. Zink, who is the chief medical officer for the state of Alaska, and myself, Clay Koplin, the mayor of Cordova, of course, and then Helen Howard, the city manager of the city of Cordova.
All right. Well, thank you all for being willing to join us. Obviously, it's a significant pivot point for any community. Dr. Saunders, maybe let's begin with you. As an important local voice in our medical response, what do folks need to know given this discovery?
So, as many already know, this morning we were notified that there was a positive screening result for COVID-19 that occurred in an asymptomatic individual that came in from out of state. This was found during screening that was completed during the individual's 14-day mandatory quarantine. The individual is in isolation. They have been complying with all of our requests and are currently in quarantine. They're being very cooperative. We are working with the state epidemiologist and public health to help keep the risk to the Cordova community low.
Okay, and so is that how you would characterize it at this point, as a low-risk event for the community as a whole?
Yes, I think in many ways we all knew that at some point we would get a positive case, and I feel very lucky that it occurred in a controlled manner such as this. We were able to quickly isolate the individual, and we will be working with the state to assess the risk for our community over the next few days. But right now I feel very comfortable with our response as well as the level of cooperation that we're getting from all parties involved.
Okay, well, thank you very much for that. Mark, let's move on to you from Ocean Beauty. What do you want folks to know about this news?
I guess one thing I would like to start off with is, Ocean Beauty operates 5 plants in the state of Alaska. We have 8 other operations down here in the lower 48. We run plants every single day of the week, year-round. And in some of these facilities, we produce ready-to-eat product. So when COVID first started to come on the radar screen, one of the things that I felt confident in is that the disciplines we have in place as a company to control listeria, which is a food contaminant in ready-to-eat products, it's a dangerous pathogen and it's really difficult to control. But we have an impeccable record on food safety of managing those kinds of issues across the company. And I thought, from a mindset standpoint, breaks in contact surfaces and being able to isolate things, we think like that and we do that. But now we need to apply those disciplines to our office environments and to, every aspect of the factories, places like machine shops that we've never really had to think like that before. And so, that's kind of the cultural mindset that we've tried to instill in our people. So when we first started contemplating sending employees to Alaska for this summer season, we were as active as we could possibly be looking for testing opportunities in the Seattle area. We identified a laboratory and we were able to secure enough tests. These are PCR tests, which is currently the gold standard for testing, that we could have enough tests to test 100% of our employees that are headed north, and then have a second test of them once they had arrived at the facilities to do a double screen of these employees. So when our employees they're all now funneled through Seattle, we thought if there's a way to catch these with this first test before we ever put them on a plane, they ever land on Alaska soil, that we would like to filter out as many of these as possible before they ever arrived in Alaska, because the infrastructure in Seattle is much better prepared to handle positive cases than really any community in Alaska. And so our first goal is to never send someone there. We when they arrive at SeaTac Airport, we pick them up in a company vehicle. We take them to a hotel that we have secured a little over 100 rooms that are ours. We put the employee in a room. We coordinate a time where the nurse is going to come to their room, take a sample. We take those samples to a lab. They're quarantined there in their room and with security. And the next day when we get their test results back and those test results are negative, then we coordinate their flight. So they might be at the hotel for a couple of days, but we then get them on a flight. If it's a direct flight to the community that they're going to work in, that's our first choice. If it's a charter, but if not, then we put them on the flight that we can get them there. We pick them up from the airport, we bring them to our facility, and they're put in their bunkhouse. And our policy is that for the season that they will be quarantined there, that we won't leave the property, that our people are going to stay there, that if they have need to interact with the community, it would be through a runner or somebody that is part of our management plan to do that. So we only have about 15 employees in Cordova at this point. These are construction machinists, people that are working very independently of each other. All of them have received their tests. All of them had a negative test. There's 2 local employees that work there, and those 2 have also received a negative test. It was our second round of testing we had a group of 9 that we tested. Their second test all came back together, and one of those individuals tested positive. So when we were notified of that last night, we quarantined 100% of our employees on site. So the employees that are in the bunkhouses, doesn't include the 2 people that work in our mess hall, but all of the people in the bunkhouse have now been quarantined individually to individual rooms, and we are now coordinating with the city and the state on what the protocol is for further testing and quarantine. I can't emphasize enough that we felt like this is the highest standard that we could come up with was 2 PCR tests. We dedicated a lot of funds and a lot of resources and personnel to manage this process. And as disappointing as it is to have a positive employee, this person showed no signs of illness. At this point, I don't believe they feel sick, but our testing procedures caught that person. We're happy that it worked. Disappointed that we have a person there on site that has the virus, but we want to assure everyone in Cordova that we're going to do everything possible to maintain the highest health standards for our employees and have virtually no interaction with the community over the course of the summer. We've contracted with medical personnel to stand up someone from Wilderness Health that will have at least a nurse practitioner on site that will help administer all of our tests and survey and take temperatures and those kinds of things of our workforce. And we have security that we're hiring from an Alaska security company, that as we get more people there, that we'll have 24-hour security to try and ensure that no one leaves the facility or breaks our quarantine policy. So with that, I guess there's any other questions that people might have. That's where we're at right now.
Okay. Dr. Castro Dale, remind us again quick of your role with the state, and you've heard from Dr. Saunders, you've heard from Mark from Ocean Beauty. What is your reaction to all of this?
Yeah, thank you so much. My name's Louisa Castro Dale, and I manage the infectious disease program at the section of epidemiology, which is in the Department of Health and Social Services. And so our role in the section of epi is to partner very closely with our local public health nurses and local healthcare facilities to do case investigations and contact tracing. And so what that means is when we get a result of a positive test for COVID-19, we connect with the local healthcare facilities and connect with that person who's positive and interview them to see where they have been, what kind of contacts they might have, and then what kind of measures to put in place as far as to minimize any further spread from that person. We're also interested in learning for anybody who does test positive what their source might have been. So looking backwards as well as looking forwards to see where that infection might have been acquired. And so in doing this, we work very closely with obviously the local healthcare facility. We also work very closely with an employer or a business that might be impacted. So we're working closely with Ocean Beauty Management to see to get all those details that Mark was providing, and then also with the City of Cordova leadership about how to work with messaging and also to ascertain how much risk there is locally. And so that's our role in this, and we're still actively investigating with those partners to minimize any potential risk to the community.
All right, thank you, Doctor. And Dr. Zink, of course, a very familiar name and voice and candidate for Alaskan of the Year in many circles. You've heard all of this as we've discussed it. What are your thoughts and what kind of perspective do you have on this news?
Yeah, no, I appreciate the time and the opportunity to be here with the people of Cordova, even virtually via radio. It reminds me of the very first day that we had a positive in the state of Alaska. It can kind of feel like you're getting punched in the stomach when you find out that there's that first case in a community. And every new community that gets a case, it always feels that way a little bit all over again. And so while it's hard to hear that there's a case down there and associated with it, I think it speaks to a couple different things. I think it speaks to the importance of a lot of planning beforehand to try to minimize it. And I can't emphasize enough how important and how grateful I am, Ocean Beauty doing testing, the medical community down there partnering, the mayor, the municipality, you with the media, and the personnel and the people of Cordova all working together. Because that's the only way that we're going to really be able to find a way through this virus. It's sneaky. It can silently spread. And as you heard with this one particular case, many people can be asymptomatic. And that's why we have to use a test in combination with other mechanisms to try to keep it out. Because once it does land on someone who is higher risk, that's where we start to see the really significant consequences and where people get more ill and can be sick. We have had cases in the state of Alaska that have shown up other ways, and I think it really speaks to the importance of really good public health, which is exactly what Ocean Beauty is doing, the community is doing, Dr. Castro Dale's group is doing, and that's the quick identification, and that's the isolation, that's the case investigation. And that's really public health, and that's really what kept SARS at bay, and that's what is keeping the numbers down in Alaska. And that combination of working really closely with you all and partners to be able to move through this. So I think it can be scary when there's a new case present in a community, and I think it's important to remember that together we will figure out our way through this. And with the tremendous partnership, I think Cordova has been a leader from the beginning on finding ways to partner, and we are here with you every step of the way through this case and beyond. We're in this together, and really appreciate everyone in Cordova working together.
All right, thank you. And Doctor, let me ask you, you heard Mark's statement about what they've been trying to do and what they have done since identifying the case. If you lived here, if you were a member of Cordova, would you, with your expertise, feel pretty good about the containment effort?
Yeah, so we have, this case has been new as of today, and so we've been on the phone a bunch of today and had the opportunity to speak to both Mayor and to Clay and Dr. Saunders a few times beforehand and then again today. And again, it's that isolation and containment. And as Dr. Saunders mentioned earlier, there's just been tremendous partnership, and people have been very cooperative, and that if I lived in Cordova, that would make me feel very reassured. And it just in Alaska in general, that has been how people have been working together, and that is why we have low case numbers, and that's why we have never had our healthcare systems overrun, and that's why we've been able to move forward, is because we've been able to partner together in a very similar way that's happening in Cordova. So that partnership is critical, and I would be reassured with the partnership I've been hearing on the phone today and previous to today.
Okay. And Dr. Saunders, if I could come back to you, sort of the same question. It's always been very important to Cordovans to know how our Cordovan medical professionals respond to things. How do you feel about the response and the containment of this case?
Right now, this is an evolving situation, so we're looking, and at this moment in time, I feel very good about what we are doing to contain it and the safety for the community. I do want to make sure that the community knows we have testing available. We continue to have testing for anybody with symptoms. We also have testing today from 2 to 4 p.m. at the Alanka Community Health Center, and we'll have testing Tuesday, Thursday, and Friday this week for anybody that has been a recent arrival into town over the last 2 weeks from out of state, or anybody that comes in over the next period of time with any out-of-state travel. They can have free testing at these locations from 2 to 4. And we'll be sending out more information on that online and through the Cordova Times.
Okay. And obviously we'll get that out, too. I saw a flyer to that effect a little bit earlier. Clay, let's come back to you to wrap it up here now. You've heard what everybody has to say. You're our mayor. What's the reaction?
Well, JR, I feel pretty good. Like Dr. Zink said, it feels like a bit of a hit in the stomach when you realize that it's come to your community. We recognize that this would probably happen in some manner or another, but I feel really good about the work of our own medical team, of the city of Cordova, and the state. We've really put some great resources in place. We've prepared very well over the last few weeks for this eventuality. Our business partners like Ocean Beauty and the other processors, the fishing fleets, the cooperation, as Dr. Zink said, of the community is really critical here. So, the sun was shining when I got up this morning. I think it's still going to be shining this evening, and it's going to be incumbent on us again to all follow the rules and maintain the social distancing and hand washing and wear the masks. Take advantage of the testing. My understanding is there's no charge for that. There's a testing schedule. We have PSAs going out this morning. Mm-hmm. And again, I just really want to thank the governor and his staff. Governor Dunleavy and his chief of staff, Ben Stevens, and Dr. Zink called me this morning at before 10 o'clock and talked through this. They're concerned about Cordova and the state's health, and just really fortunate that we've had a really proactive administration that has protected Alaska, I think arguably the best of any state. So just appreciate that partnership and support.
Okay, well, thank you again to the panel very much. Clay, one more quick question. What right now, because information, as we have learned through our mutual studies of FEMA response and Cordova response and everything, that information literally means as much as food and water to a lot of folks. So if people want to get the most current information, where would you point them at this point?
I would continue to go to the COVID-19 .cityofcordova.net website, and that really has all the links to the state of Alaska and to the local happenings. We are reaching out to media, and they're reaching out to us, as you can imagine, Cordova Times, yourself, so forth. So this is evolving, and I would encourage people to recognize the credible sources of information. You could make thousands of inappropriate assumptions. We have no idea if somebody contracted it here in Cordova, if it was a false positive. I mean, there's thousands of scenarios. So really, we just need to wait for the actual information to transpire and be shared with the community to know where we're at, and that will unfold in the coming days.
And you're talking about if there are future cases, obviously. Well, again, a big thanks to everybody on the panel, really good group of folks, and we wish everyone the best and hope everybody stays safe, and we'll go ahead and bring this to a close here. You've been listening to the Daily Briefing on KLAM and KCDV. These briefings come to you each weekday to bring you the most current information available on Cordova's COVID-19 response. The 1 p.m., 5 p.m., and 8 p.m. hours on the radio, and then we archive them for you to hear later or share with anybody who might have missed one. They are archived on our YouTube channel, which is youtube.com/Cordova TV. And a reminder again to get the most up-to-date information on response and advice and regulations and so forth. The city's website for COVID response is covid19.cityofcordova.net. Again, covid19.cityofcordova.net. Thank you again for listening, and we'll get you back to regular programming now on KLAM and KCDV.